I'm Dr. Ola Akimboboye, President of the Association of Black Cardiologists. Did you know that heart disease is the #1 killer in the United States? Did you know that on average, every 34 seconds, someone dies from a heart attack?
In 2008, on my way to work, I suffered a heart attack.
I can't begin to tell you what we went through to find a doctor that would help us understand what was going on with him and how we could manage his health issues.
So each year, there are more than 500,000 Americans that die from heart disease. Heart disease is more deadly than most forms of cancer, stroke, and all other forms of death combined.
Each of us has a family member, friend, or loved one who is suffering from heart disease or any of its related conditions. But it doesn't have to be this way. At the Association of Black Cardiologists, we have identified 7 steps that you can take to help maintain a healthy heart. Being spiritually active has been shown to be quite helpful in terms of improving your chances of having a long and healthy life. Studies have shown that patients who are spiritually active live longer and healthier lives than those who are not.
Church is very important. Church has an element that brings about a peace and a knowing that there is a God, and that if you take care of your body, which is God's temple, that God will then take care of you.
One of the things that I think we desperately need is we need shepherds to take responsibility for their health and lead by example so that the sheep can follow.
To take charge of your blood pressure, you first need to measure it, because you can't manage what you don't measure.
One of the most important things for people is to realize that they need to start by taking charge of their own health care. And they need to know what the symptoms are of a heart attack or a stroke, so that if people experience those symptoms, they don't wait and put them off and they go directly to a hospital that can take care of them for those things.
To maintain a good cholesterol level, you need to visit your physician and have your levels checked. Now, in terms of cholesterol, we talk about total cholesterol, the good cholesterol, the bad cholesterol, and your triglyceride level. All of these levels are important. The appropriate level for you depends on your medical history. For example, patients who have diabetes or who have existing coronary artery disease require stronger medicines and lower cholesterol levels than those who do not.
Basically, what I found out in this whole process was that it's important to develop a relationship with your doctor. And one of the reasons why black men suffer more than any other constituency is that they don't pay attention to the signals. We have this thing that we have to be strong, and we don't see doctors on a regular basis. We don't do the necessary things to have a good, healthy heart.
Diabetes is a major risk factor for coronary artery disease. To ensure that diabetes does not promote heart disease in you, it is important to visit with your physician to track your blood glucose level and prescribe appropriate treatment if your levels are elevated.
I was a professional football player, and over the years after my retirement, I gained way too much weight. 5 years ago, I got a wake-up call from my doctor who told me I was pre-diabetic. I had to make some choices about how I was going to live the rest of my life. By God's grace, I was able to lose the weight. I lost over 80 pounds. I began running, and since then I've run 4 marathons.
It is important to pay attention to the quantity and quality of food that you eat. In addition, you want to make sure that you participate in regular exercise, at least 30 minutes every day.
Not only to have to go to the gym to exercise, but you can walk up the stairs instead of taking the elevator. You can, walk 10 blocks to the supermarket instead of taking the bus. There are things you can do just to increase the number of steps you take every day. And that's been proven to be a way of improving people's cardiovascular health and reducing their risk.
Heart disease is the leading killer of all people in the United States, but heart disease is a leading killer of women. Heart disease is a leading killer of African Americans. So when you combine being African American and a woman, it's particularly important and particularly devastating at times because you have a double risk factor that you're dealing with.
In fact, the average life expectancy for a Black female in the United States is 77.8 compared with 81.1 for white females. Steps number 4 and 5 have to do with managing your weight and physical activity. Black women in general tend to be less physically active, 24.1% compared with 36.2% of white women. And they tend to be more overweight or obese, 58.5%, almost 1 in 2 Black women over the age of 20 are classified as being obese, compared with 32.2% of white women. So how do you manage these risk factors? Studies have shown that being physically active can help you to manage your risk factors. Exercising 30 minutes on most days of the week is very important.
Nicotine, which is present in all tobacco products, damages the lining of your blood vessels, thereby promoting the development of heart disease. It is important to take control of your health by seeking out the best healthcare provider that you can find, even if it involves traveling outside your community.
The Affordable Care Act is a historic law that was passed by President Obama and Congress, and its purpose is to provide insurance to everyone that does not currently have insurance. African Americans are 55% more likely to be uninsured than white Americans. The primary goal of the new Affordable Care Act is to make health insurance coverage more affordable and accessible to millions of Americans, particularly when it comes to the African American community. There are many ways to access this insurance. You can go to a website, healthcare.gov, in order to access that insurance, or you can call 1-800-318-2596. And if you need a TTY line, that number can be found on the website as well.
Our mission at the ABC is to promote the prevention and treatment of cardiovascular disease, including stroke, in Blacks and other minorities, and to achieve health equity for all by elimination of healthcare disparities.
Let's fight together to reduce cardiovascular disease by the year 2020 so that cardiovascular disease is no longer a leading cause of death.
For a free copy of the 7 Steps to a Healthy Heart booklet, or to find out more about the Affordable Care Act and the health insurance marketplace, visit the Association of Black Cardiologists website. Remember, the heart is the engine of your body. Don't take it for granted. Be good to your heart, and it will be good to you.